So now we have Dr. Nibha Mishra, and her paper's title is Advanced Glycation End Products are Biomolecular Biomarkers of PDR.
Good morning. At the outset, I'd like to thank AIOS Scientific Committee and my mentor, Professor Sandeep Saxena, for supporting me in my research. My research title is Advanced Glycation End Products are the Biomolecular Biomarker of Proliferative Diabetic Retinopathy. We all know that we live in a world where diabetes mellitus has grown to an epidemic level. With diabetic retinopathy, a major neurovascular complication affecting the functional group of population with vision-threatening complications. So no stone has been left unturned to understand the pathogenesis of diabetic retinopathy. In this, what we have studied is been known and has been studied as one of the major triggering biomolecule for all the pathogenesis. So what happens? Hyperglycemia. It leads to a non-enzymatic glycation reactions, which leads to an irreversible damage to the structural and functional integrity of our basic skeletal framework of our body, that is proteins, lipids, and nucleic acids, where comes the concept of metabolic memory, which states that even after the reversal of hyperglycemia, this damage is permanent. So that leads to the generation of advanced glycation end products, and the molecule I will be studying or stating to you is about N-carboxymethyl lysine, which is one of the commonest one. As earlier stated, we will be studying we studied the role of ages as a biomolecular biomarker for proliferative diabetic retinopathy. In our study, it was a cross-sectional tertiary care center-based study, and we divided the study into 3 groups with no diabetic retinopathy, diabetic NP non-proliferative diabetic retinopathy, and PDR. All of them were 40 to 65. Age and sex match controls were taken. What was the exclusion criteria? All the retinal, any patient with existing retinal vascular pathology prior treatment, patient should be treatment naive, or any condition where NCML, the ages levels are supposed to be high, were excluded. A detailed data collection was done, including demographic details, and all the clinical data was taken. The blood investigation was done with special emphasis on the serum glycemic profile and the assay of NCML. The serum NCML was done by quantitative sandwich enzyme immunoassay technique. The relevant statistical analysis was done, and our power of a study was 94%. In the results, I like to highlight the main things that our study, all the groups were age and sex matched. The duration of diabetes in the NPDR group and PDR group was was comparative, and no significant difference was there. The NCML levels were rising in the groups as we proceeded from the severity from control to proliferative diabetic retinopathy. But what is noticeable is that the glycemic status, if we see NPDR and PDR, the HbA1c levels were not significantly different. This is what the scatter plot shows about the NCML and the visual acuity, the functional changes which we saw with the severity, the visual acuity decreased. That is, with the increase of NCML, the visual acuity was decreasing. So coming on to a major analysis was the receiver operator characteristic analysis. On AUC analysis, what we found was, if we see this chart of ROC curve analysis, on the vertical axis we have the sensitivity, and the horizontal axis we have the specificity, and the AUC for PDR is coming out to be 0.842, which is quite significant for a diagnostic tool. So the ages range axis leads to continued cellular dysfunction. Ages cause retinal pericyte apoptosis, stimulate VGF. Ages trigger oxidative stress, and even now they are the new therapeutic targets for diabetic retinopathy. So why we are going towards something different rather than HbA1c is there are genetic variants which affects the HbA1c level. There are chemically modified erythrocyte survival rate affects them. So they do not actually sometimes shows us the actual glycemic control. So in conclusion, I would like to say that ages are the major biomolecular biomarker stating the pathophysiology of evolution of diabetic retinopathy. They are the novel therapeutic targets. They are new age tools of translational medicine. We were able to publish our research in IGO. Thank you.
Thank you, Dr. Nibha.
Thank you, sir.
That's a very interesting development. So they not only tell us which patients are going to develop the advanced disease, they also give us therapeutic target also.
Yes, sir. The
So that we
predictors.
can target these advanced glycation and
Yes.